Vaginal yeast infections are a common and frustrating health issue that many women experience at some point in their lives. These infections, caused by an overgrowth of Candida albicans, can lead to uncomfortable symptoms such as itching, irritation, burning, and abnormal discharge. While there are many factors that contribute to yeast infections, one of the most frequently discussed is sugar consumption. But does sugar really cause vaginal yeast infections? Can cutting down on sugar help prevent or even treat these infections? In this video, we will explore the relationship between sugar and yeast infections, how sugar affects Candida growth, and what dietary and lifestyle changes can help maintain vaginal health. A vaginal yeast infection, also known as vaginal candidiasis, occurs when the natural balance of bacteria and yeast in the vagina is disrupted. The vagina naturally contains a mix of bacteria, such as lactobacillus, and yeast, including Candida albicans. Normally, the bacteria help keep yeast growth in check, preventing infections from developing. However, when this balance is disturbed, due to factors like antibiotics, hormonal changes, weakened immunity, or excessive moisture, Candida can multiply rapidly, leading to a yeast infection. Common symptoms of a vaginal yeast infection include 1. Intense vaginal itching. 2. Burning sensation, especially during urination or intercourse. 3. Thick, white, cottage cheese-like discharge. 4. Redness and swelling around the vaginal area. Yeast infections are not sexually transmitted diseases, STDs, but they can sometimes be triggered by sexual activity. They are also more common in women who are pregnant, diabetic, or have a weakened immune system. The idea that sugar contributes to yeast infections is based on the fact that Candida thrives on sugar. Just like any other fungus or microorganism, Candida needs nutrients to grow and multiply. Sugar provides the perfect fuel for this process, allowing yeast to overgrow and cause infections. There are several ways in which sugar impacts vaginal health and yeast infections. 1. Sugar feeds Candida growth. Yeast, including Candida albicans, relies on sugar as a primary energy source. When you consume a diet high in sugar, excess glucose circulates in your bloodstream and body tissues. This extra sugar can create an environment in which Candida thrives. Women who consume a lot of refined carbohydrates and sugars, such as white bread, pastries, candy, and sugary drinks, may have a higher risk of yeast infections because these foods elevate blood sugar levels, fueling yeast growth. 2. High blood sugar weakens the immune system. A strong immune system is crucial in preventing yeast infections. It helps regulate the balance of microorganisms in the body and prevents overgrowth of harmful ones like Candida. However, consuming too much sugar can weaken the immune system. Studies have shown that excessive sugar intake impairs the function of white blood cells, which are responsible for fighting infections. This means that when sugar consumption is high, the body's ability to control Candida growth is compromised, making infections more likely. 3. Sugar disrupts vaginal pH balance. A healthy vaginal environment is slightly acidic, with a pH of around 3.8 to 4.5. This acidity helps maintain a balance between good bacteria, lactobacillus, and yeast. When you consume too much sugar, it can alter the vaginal pH, making it more alkaline. This pH shift can reduce the number of beneficial bacteria in the vagina, creating an environment where yeast can flourish. 4. Diabetes and increased risk of yeast infections. Women with diabetes, especially those with poorly controlled blood sugar levels, are at a significantly higher risk of developing yeast infections. High blood sugar levels create an environment where Candida thrives. In addition, sugar is excreted in urine, which can make the vaginal and urinary tract areas more susceptible to yeast overgrowth. For diabetic women, managing blood sugar levels through diet and medication is essential in preventing recurrent yeast infections. Since sugar plays a key role in feeding Candida, many experts recommend reducing sugar intake as a natural way to prevent and manage yeast infections. Lowering sugar consumption may help. 1. Starve the yeast and slow its growth. 2. Support a healthy vaginal pH. 3. Boost immune system function. 4. Reduce inflammation in the body. Women who frequently experience yeast infections may benefit from a low-sugar diet, which focuses on whole, unprocessed foods while limiting refined carbs, sugary snacks, and sweetened beverages. If you're prone to yeast infections, making dietary adjustments can support vaginal health. Here are some of the best foods to incorporate into your diet. 1. Probiotic-rich foods. Probiotics help maintain a healthy balance of good bacteria in the vagina, keeping yeast growth under control. Foods rich in probiotics include yogurt, kefir, sauerkraut, kimchi, miso, kombucha. 2. Fiber-rich foods. Fiber helps regulate blood sugar levels and supports gut health, which in turn benefits vaginal health. Some good sources include vegetables, such as broccoli, spinach, kale, fruits, such as berries, apples, pears, whole grains, such as oats, quinoa, brown rice, legumes, such as lentils, beans, chickpeas. 3. Garlic. Garlic has natural antifungal properties that can help fight Candida overgrowth. Adding fresh garlic to your meals may provide some protection against yeast infections. 4. Healthy fats. Good fats support hormone balance and immune function. Some beneficial sources include avocados, nuts and seeds, such as almonds, walnuts, and flax seeds, olive oil, fatty fish, such as salmon, mackerel, and sardines. 5. Cinnamon and coconut oil. Both cinnamon and coconut oil have antifungal properties that may help combat yeast infections. Using these in cooking or adding them to teas and smoothies can be beneficial. To reduce your risk of yeast infections, it's best to avoid or limit the following. 1. Sugary foods, such as cakes, cookies, candy, and soda. 2. Refined carbohydrates, such as white bread, pasta, processed cereals. 3. Alcohol, especially beer and sweet wines, as they contain yeast and sugar. 4. Processed and fried foods, which can cause inflammation and weaken immunity. In addition to dietary changes, other lifestyle habits can help prevent yeast infections include 1. Wear breathable, cotton underwear to keep the vaginal area dry. 2. Avoid douching in scented feminine products, as they can disrupt the natural vaginal flora. 3. Change out of wet clothing, such as swimsuits or workout gear, quickly to prevent moisture buildup. 4. Always practice good hygiene. 5. Manage stress, as high stress levels can weaken the immune system. 6. Stay hydrated, as proper hydration helps flush out excess sugars and toxins. While sugar itself does not directly cause yeast infections, it plays a significant role in fueling Candida overgrowth and making infections more likely. Excess sugar can disrupt vaginal pH balance, weaken immune function, and create an environment where yeast thrives, especially in women with diabetes or high blood sugar levels. If you experience frequent infections, consider making dietary changes and consulting a healthcare provider for personalized advice. Did you find this video helpful? Like, comment, and subscribe for more health tips. See you in the next video.